The President of the United States, Donald Trump, has been criticized for calling COVID-19 the Chinese virus. Here in Africa, the virus is largely imported, with index cases in countries being reported from foreign nationals. This is attracting discrimination amongst foreigners. Here in Ethiopia, for example, some non-Ethiopians are reporting cases of physical and verbal attacks from some Ethiopians. Some foreign journalists have had their photographs retrieved from their social media pages and labeled as corona. The Africa CDC says the virus has no nationality.
You expect in a pandemic that there will be social harm, that people will be stigmatized, discriminated. It is up to all of us collectively to build a front against that and say that an infection with coronavirus is not a death sentence and it's not something that anybody asks for. And we have to, if we have to win collectively. It cannot be discriminating people and stigmatizing them. We have seen what stigmatization has done for the fight against HIV. It only helps to weaken it. Discrimination, stigmatization, they're all parts of human rights. This becomes a serious human rights issue if we begin to discriminate people, profile them, and attack them.
Dr. Nkengason says trends are showing that the epicenter of the virus can easily shift, with Europe now bearing the biggest brunt after China. He says mass testing may not be possible in Africa, partly because of resources.
If you just go out and you're testing in communities that just want to know if they have corona or not, it doesn't help. Because again, we should be very careful that testing is not a coded word for "I'm protected from corona." If you are tested today, it doesn't mean you will not be infected tomorrow. So that is very, very important there. I think that is why targeting testing and appropriate testing is important.
The African Union's human rights body says Africa must give special focus to its young population during this time of pandemic because they make up over 60% of the population.
Because they are also the most active sector of society, actually, according to some studies, the youth, because they don't know and because they are socially active, they can transmit the disease or the virus 10 times more than adults. According to the study that was conducted in South Korea, due to the public testing that they have undertaken, actually the youth are the one that carry the most of the virus. Nearly 1/3 of the public that have been tested that carries the virus, it is the youth. And there is also, therefore, a very important intervention, particularly from the side of the media, to ensure that the youth actually internalize the scientific advice.
The Africa CDC says there will be more testing kits available to Africa in the coming weeks, now that 3 companies have started manufacturing them. Coletta Wanjohi, SABC News, Addis Ababa, Ethiopia.